different. I want to start off by thanking you for joining in early and for joining in once again for this session, which takes place every last Saturday of the month at 10 a.m. The series of In the Driver's Seat, Aging with Intention. Thank you very much for coming in early. We are excited that you are here with us again. It shows a great commitment on your side. Before we begin, I'll have a few announcements to make. And the first one is our team is planning to start a WhatsApp group for seniors and carers. The aim of this group, WhatsApp group, is to share knowledge on how to manage daily challenges in the age group, to share tips of caring for seniors and also provide the much needed support to carers. If you are interested in joining this group, kindly indicate your name and phone number in the chat so that we can pick it up as we go along in this session. You can also send an email privately through our email, purposefulaging@gmail.com. I think I'll have to keep repeating this for the sake of the people who join later on. The second announcement is that really not an announcement, but housekeeping. Today we are going to have live questions and answer from you, the participants. We will have 2 guest speakers already known to you, and I will introduce them shortly. We will have Professor Nakasujja and Dr. Makanga to answer these questions. But as usual, we do welcome full participation from you. You can raise your hand, you can put your questions, comments in the chat so that we have a lively and participatory session. It's going to last 2 hours, so we really need to be vibrant, all of us. I'll now introduce Professor Nakasujja, whom we've had here before. She's an associate professor of psychiatry and is the head of psychiatry department at the College of Health Sciences, Makerere University. She has expertise in geriatric mental health and is part of the Alzheimer's Association of Uganda. Geriatrics is to do with the aged. So we have the right person with us. And we also have Dr. Makanga. He's a physician with specialist training in nephrology, that is the kidney diseases and hypertension, which we normally call high blood pressure, or for those of born before independence, it is the PLESA. He's an honorary lecturer in the Makerere University College of Health Sciences and currently working at the Bank of Uganda. Bank of Uganda clinic, where he's actively involved in managing retired senior citizens and other bank staff. Our guests are clearly experts in managing the elderly. We are privileged to have them join us to answer questions about managing mental health issues and high blood pressure in the elderly. If you are caring for a senior, we are looking forward to your questions too. And please feel free to use Luganda or any other local language or any form of communication which you find easy, so that we share your concerns and we try to solve your problems. To keep us organized, as I've said earlier, we'll have to keep a few house rules. For those of you who are able, please use the reaction button to put up your hand or to lower it after you've answered, so that we can find it easy to guess who is ready to communicate to us. You can also use the chat room to put your questions or comments. And most importantly, please remember to keep your mics muted throughout the session if you are not communicating directly. This is very important because it really helps us to get a smooth session. For those of you who have just joined us, this morning is a time we are going to spend asking questions, making comments to our guest speakers, whom I've just introduced. And also you're free as a participant to make comments, put up your hand and raise a comment, raise a question, and also put in the chat. I'm just repeating this for the sake of those who have just joined us. The two guest speakers are already with us, and I'm ready now to receive any questions or comments for the session. Maybe to start you off, I'll ask a few questions myself. I'll use my privilege as the moderator and ask put two questions to each of our guest speakers, and they can answer them. We'll start with Professor Nakasujja to answer the questions. Professor, good morning once again. I have a simple question to you. Does daytime sleep or napping help at all with the brain health of especially of the aged?
Thank you very much.
That's question number one. And
right.
Probably let me throw the questions to you, and then you can answer them. I'll give you your two questions, and I'll also give Dr. Makanga the two questions, and Professor will answer first. The second question to you, Professor, is how can one deal with a senior who is seclusive? And to Dr. Gyaviira, what exercise is safe to do for the elderly to keep fit and avoid or control high blood pressure? The second question is, what are the best foods one can eat to lower high blood pressure? We'll have Dr. Nakasujja. And please, participants, do put your questions in the chat room or raise your hand for us to see you. Thank you.
Well, thank you very much, Dr. Christine, for those questions. I think before I get into the details of who is older adults, it's important for all of us to be on the same page of who we describe as older. That will be my only definition, and then we're going to the specific question. So previously, as many older adults may know, the age of retirement is 60 in Uganda, 65 in most other places. And it used to be considered, those are people who we consider as older adults, but revisions have been made to that age, both in high income settings as well as for the low income settings. In high income settings, there are places where they're arguing that there is, no limit. But the United Nations recognizes that if a person is 60 years and older, then we are going to classify them as an older adult. So when it comes to sleeping, when you talk about younger people, having a nap, or what we call power naps, especially at the time when you at your productive years, I mean, even when you are a child, it's very helpful. It's very rejuvenating for the brain for one to have a short nap, 30 minutes or even less. But when you grow older, the more you sleep, the more you're likely to develop challenges with how your brain functions. So there are researches that have been done that have shown that people who sleep a little too much during the day may have a 40% chance of eventually developing dementia. For patients who may already have dementia, sleeping too much during the day also makes them, not to be very clear in their functioning. So on the whole, daytime napping for older adults is not a benefit as it would, as you would have expected that maybe if they sleep, they would perform better. No, it doesn't. So keep them active. They're allowed to nap, maybe 2 naps a day, but no longer than that, because it's dangerous for their cognitive functioning. Before I move to the next question, does anyone want to seek clarification from that? Okay, we'll move on to the next question, which, no, Jane Francis, you wanted to say something.
I don't see any hands up.
Hello. Hi.
Yes, Eva.
Thank you very much. I would like to ask, when you say the naps, when you say the elderly now, are you talking about from 60, 65, or are you talking about the 80-year-olds for taking the two, not about taking the 2 naps? Because that's all I wanted to ask.
So the information I'm sharing is for older adults, that is anyone who is 60 years and above.
Oh, wow. Okay, thank you.
No, it's not good for you to oversleep during the day. Keep active. You could rest a little bit, but do not make it too much, because the more you oversleep during the day, the higher you increase your chances of eventually developing dementia, especially Alzheimer's.
Okay, doctor, what about the ones who are like, let's say 80s, 90s? Because sometimes they just keep dozing off, Does that also apply to them, or by that time it's okay?
If they sleep for, I mean, it depends. Are they okay cognitively, or do they already have dementia? I don't know.
No, they don't have dementia. They don't have dementia.
For as much as is possible, it's not automatic that if one is over 90 or 80, they should sleep, unless they have other ongoing physical ailments that may be making them weaker, which makes them have to go to bed. But otherwise, if they are generally healthy from the hypertension, heart perspective, there's no reason as why they should be oversleeping. They should, keep active, or if they don't have too much severe arthritis that stops them from moving around, you should encourage them as much as is possible in not oversleeping during the day. Much of the time they sleep anyway because they are not being engaged, because people tend to seclude them, leave them in a corner. And, if you're that redundant, what happens? You end up sleeping.
Professor, maybe you want to recap, like how long should one allow the elderly or the aged to sleep in, let's say, in the afternoon, because carers tend to feel that, this old person is not, we are used to making people sleep after maybe lunch or in the morning, like after a walk. We need to have an idea of what you would recommend as how long should this person be allowed to sleep, or what should we take as good for that aged person to sleep? How long they should take to rest during the daytime?
So ideally, when we say a word nap, it should be about 30 minutes to 1 hour, no more than that. Because you see, if you also interfere too much with their daytime sleeping, they will have challenges sleeping at night, which is more destructive for both the patient as well as the caregiver. When the patient is awake at night, when the caregiver would also like to sleep at the same time.
Thank you.
If you find that your loved one is sleeping more than 9 hours a day in total over the 24 hours, then there is a problem. So that is adding the nighttime sleep together with the daytime sleep that they may engage in. It's not, it doesn't give a good result from studies that have been done. If you sleep more than 9 hours a day, the chances of you becoming more cognitively impaired are higher than if you slept less than 9 hours a day.
Okay, thank you. At that juncture, would Dr. Makanga want to put in a word? Because I think you recommended a bit of rest, and this rest can easily be taken as sleep, to mean sleep.
Yes, thank you, Dr. Christina, and thank you, Professor Nakasujja. Incidentally, Professor Nakasujja was my teacher, so I am very glad to have her here. And her topic for today, mental health, is directly related to high blood pressure in the elderly in so many aspects, like we shall see as the discussion goes on. Like she rightly said, the elderly are actually supposed to have adequate sleep. Remember in the previous discussion that I made, for those of you who attended, the aspect that Professor has put forward about the senior citizens sleeping a lot and being very inactive in their beds or in their seats in their sitting room is one of the risk factors for so many things like obesity, poor bone health, and high blood pressure, and many others. The more inactive you are, the body also slows down. So they will get issues like digestive problems like constipation, infections, pneumonias. They're going to put on a lot of weight, which weight is going to give them diabetes. And all these are kind of interrelated and they're going to predispose you to getting high blood pressure. And so we much as we want them to nap, in total agreement that the recommended daytime nap or that afternoon siesta should be not more than an hour. And then they get back on their feet to be as active as possible. And in the night, I think in my talk as physicians, probably the professor will add on, we want them to at least have adequate sleep of at least 7 to 8 hours as a minimum. That's for the night. I don't know whether I'm answering the question right at this point in time.
I think we are okay, unless if there's a caregiver who still has an issue. But it's now clear at night we should have a minimum of 7 to 9 hours, 7 hours, but 24 hours, a minimum of 9 hours of sleep. So we need to have that at the back of our mind when we are complaining that this old person is not accepting to sleep during the day. We should not exceed 9 hours, total 24 hours. Professor, I think you still had a question to clear.
Yes. Yes. So I think this term, the person who previously asked this was concerned about adults that are seclusive. I'm not sure if they are online, but I'm going to guess what they mean. The old adults who don't want to interact, is that what they meant? What do you think the question meant? Or who keep to themselves?
I think we can only take it like a senior citizen who doesn't want to interact with others. They want to be on their own most of the daytime. I'm not quite sure myself whether this is exactly what they wanted, but I think it's common for senior citizens to want to be left alone. Let me put it like that.
Okay.
Leave me alone in my chair with the teapot of tea there.
Okay, I'll approach it in a broad sense still to cater for whatever it is that may be read as seclusion from the older adult. So let me begin with personality and previous, way of life of that particular individual. Before we call them as people who are seclusive, have they always wanted to interact with people, even when they were younger? Those are questions we ask ourselves, because you can't expect someone who maybe may not be like Dr. Christina, you mentioned to us last time how you like to interact with your grandchildren, play with them, keep alive with them. But that is part of your personality, that you've always wanted to be possibly a person who interacts much with other people. Now, if you find someone who previously was not that kind of person, you can't all of a sudden expect them to learn a new skill of social interaction in their old age. That becomes a bit of a problem. I know people who like to live in their own flat, keep their space, and they are happy to be by themselves. So it becomes a challenge for you to want them to be that socially interactive when they grow older. So many times the caregiver has to be appreciative of, you know, what that person previously used to be and what it is that they are doing now. Now, if someone was previously social, they interacted well, and then as they grow older, they become more seclusive, it could be one of two things. One, it may be, you know, as people grow older, they become more and more lonely. They lose loved ones, they stop to work, they lose positions of social responsibility, and well, they just, you know, kind of get into a corner. And it doesn't mean that they do not get hurt, you know, by this change in lifestyle, because possibly it doesn't make them any happier. So sometimes you may find that what's keeping them secluded is loneliness. And when they keep quiet to themselves, the people who are around them also distance themselves instead of reaching out more to them. Oftentimes they do not talk that much to them other than, you know, greet them, good morning, grandpa, and, you know, they don't engage in conversations about what's going on with them. So they feel rather secluded. Sometimes their children do not visit anymore, and the rates of depression for older adults, you know, become much higher than younger people because of all these things. And so sometimes one needs to really look into, why are these people keeping to themselves? It's first important for us to understand why they are doing so, rather than thinking they have just chosen that as their stance of, you know, moving forward with life. That said, we who are around older adults, as well as all caregivers, need to reach out, engage, talk to them. I think I did give you an example the last time, even in hospital when they come. Some medical personnel have a tendency of talking to the caregiver. I mean, how can you ask my problems from the caregiver? Ask me, I'm the patient. So I did a study previously where I was engaging with them directly, and at the end of each session, they would thank me very much. I mean, I was a young doctor at that time, and I was wondering, why are they thanking me? And more than 3 or 4 of them were saying, you see, no one talks to us. And in saying no one talks to us, they meant their people with whom they stay with, as well as the medical personnel in the hospital. They arrive in hospital, it's the other person who is speaking on their behalf, as if they can't express themselves. And remember, at this time, you have slowed speed of psychomotor functioning, or ability to interject and, you know, oppose whatever the other person is saying. So most times they will just look on and, you know, ride along with what people are saying. But engaging would really, in all aspects, would help a lot in reducing this seclusion of older adults, and understanding what the primary problem may be, and then dealing with it. Thank you.
Thank you very much, Professor Nakasujja. I just wanted to add on a little bit on that. It's really not written down, but with our seniors, the type of engagement also matters a lot, because if I'm a caregiver and I'm 25, my couples is likely to be very, very different from the couples the caregiver is likely to be interested in. And it might just be noise to them. So as a caregiver, maybe it might be useful for you as a caregiver to try and talk about things of long ago, Edda Enyo, things which happened 60 years before. So the engagement you might want to initiate with a senior would be, tell me about independence. Did you come to Kololo? Because now for you, you are 20 and you don't know anything about independence. And yet this senior is the one who was actively involved in that. So as a caregiver, you try to take them back in their time. They will remember and they will enjoy telling you about it. But if you try to tell them about this, the popular singers of today, is it Awazi or Zawadi, somebody like that, Zawede? They will have no idea of what you are talking about. And they are likely to just even say, why don't you go away? I just want my space to myself. And on top of that, we've got a few comments coming in. I think I can read them at this time and it might help the Dr. Makanga when he's answering his question.
Okay, so maybe Dr. Philippa, before you go to those, I just wanted to supplement on what you have just talked about. So while it may be wonderful for you to engage them with stuff that happened way earlier, I mean, they enjoy talking about the things, what it is that they used to do, but you may find that it may not be possible to have that same conversation, you know, like all the time. So depending on whether they have dementia or do not have dementia, people who do not have dementia can still engage with current events. And we like so much for people to engage with current events. Even when they've started to develop dementia, we like for them to engage with current events. We like to reorient people with, you know, what is happening now. I had a 74-year-old last week, and as we were, you know, discussing things, there is an event that happened last week. I was surprised he was up to date with Mao being, you know, nominated for Minister of, I don't know, whatever it is that he got. I was impressed that, you know, he's kept abreast, and, you know, that can be a point of maybe laughing and say, oh, one of my students was like, oh, you're so up to date with information, and he felt good that, you know, one could praise them for keeping up to date. So keeping abreast with news, I mean, important news, they may not know the singers, but of events that are happening in the country, that there is no fuel, or, and then reassure them that, you know, all will be well, will eventually overcome this, also becomes very important. Thank you.
And thank you very much, Professor. Yes, for Dr. Makanga, we've got a comment from Darlene. It is vital to make sure the senior is not compensating for the poor sleep at night. In some seniors, there is a change in the normal sleep cycle. The day nap may be a catch-up opportunity as long as it does not affect the normal sleep at night. Then the other comment is from Philippa. Speaking of loneliness, what activities would be recommended for older adults to engage in when they do not have work anymore? I think Professor and Dr. Makanga, you can see how you can answer these questions. But I think it's time for Dr. Makanga to answer the two questions posed earlier.
Thank you, Dr. Christina, and thank you, Dr. Dallin. For those of you who don't know Dallin, Dallin is a physician, and I thank him for tuning in. Actually, he will probably also make a few comments from his experience he has from the other side of the world. He's also seeing quite a number of elderly citizens, probably a little different from us here because he's seeing Australians. But yes, I totally agree. Some of these senior citizens will have altered sleep patterns because of their comorbidities. And like he rightly said, some of them may actually be sleeping during the day to compensate for what's happening. I'll give an example. There is a disease or a disease condition called obstructive sleep apnea. And this usually happens in people who are very obese or overweight. And it's one of the common causes of high blood pressure because these people tend to have interrupted sleep in the night because they keep waking up because of obstruction to their airway. So they can't breathe so well and they snore quite a lot. So their spouse or dependents might actually report that so-and-so snores quite a lot and keeps waking up. So they tend to compensate by daytime sleepiness. And so when we're assessing this, we look into all of that. So like Dr. Dallin has said, we need to consider all those factors. Then about the physical activities that the elderly can do to keep fit. In my last discussion, I will just highlight what I mentioned about this. When we are prescribing these activities, especially in the senior citizen, and now, and like Professor said, for the sake of this discussion, the senior citizen is the one who is 60 and above. But these activities do also apply to all of us. Now, for the senior citizens, we want to assess them and categorize them based on their level of frailty. We want to look at the degree of frailty because there are those who are going to be very fit, even at 80. For those of you who have been, well, all of us in Uganda, and I think Dallin, who is in Australia, must have witnessed this probably on media. A couple of days ago, there was a marathon where thousands and thousands of people participated. And there were quite a number of senior citizens in that marathon. You could actually see them running. So we would assume that some of those fall in that category of very fit, if they could manage to go maybe a kilometer or so. So we categorize this, the senior citizens as based on the level of frailty, their level of disability, their level of comprehension and social support. Sometimes we also look into their comorbidities. What do they have? Do they have joint problems? Do they have stroke? Do they have diseases like Parkinsonism that they call oboko here, the tremors? What kind of drugs are they on? There are drugs that cause a lot of dizziness. And based on all that, you want to prescribe the physical activities based on that level of all those factors. And one of the exercises that we'll give based on that will be simple things like brisk walking. And remember, in the other talk, I mentioned that what is recommended now is physical activity of at least 30 minutes a day, which translates to 150 minutes per week. So brisk walking for about 30 minutes or more, if you can handle. And again, based on what you are capable of. Jogging for those who can jog. Dancing is a good exercise for elderly citizens, and it's even fun because these days they're even dancing, I think, clubs where people go and gather and dance. It's a good way to also relieve stress and anxiety because you're meeting many other people. Swimming for those who can. But again, for those senior citizens who have, whether it's small compound or big compounds, you can actually engage in everyday gardening instead of of leaving it to the children or a gardener, you could actually do it with them. And then you could also play games with the grandchildren, say on a weekend when they come to visit. Now, a point to note, especially for the senior citizens, is before you engage in any of these exercises that are going to make you sweat, we usually encourage you to keep hydrated before and after. And the reason for this is if you are on certain medication for, say, your high blood pressure or any other, but I'll single out certain blood pressure medications that lower blood pressure by increasing your urination. You might actually lower your blood pressure because you haven't drunk a lot and you're sweating a lot from the exercises, and that can actually cause falls and then cause other problems. So always encourage these senior citizens to keep hydrated. The other thing I didn't mention is that when we're assessing, we also want to as we're prescribing these exercises, we also engage the caretaker, especially for those citizens who might have issue, what Professor Nakasujja mentioned, dementia or Alzheimer's, or have some kind of cognitive dysfunction and may not be able to comprehend the instructions we are giving them. So we want them to do these exercises in company of someone, because you might tell them to walk and that's what they will actually register, and then they walk and disappear or get knocked by the borders or a car out there. So those are some of the physical activities that we would recommend. Thank you.
Thank you very much, Dr. Makanga. I just want to add on again on the activities, just a short story, which would help caregivers to be mindful and be more patient with the seniors. This senior was living in Kampala with, of course, a daughter, and there wasn't much of a garden to engage in, but she loved gardening as a youth and middle-aged. So when she came to Kampala, she wanted to continue with that gardening. So she would go out in the garden and just uproot everything in the garden, in the thinking that she's actually digging. So the caregivers and the family understood that, oh, this is the way she thinks she's carrying out the act of digging. So after she has uprooted everything, she will go back to the house and will be very happy she has done her gardening. So what the caretaker had to do is now replant all those things in the evening for her to come the following morning and do her gardening, which is uprooting all this so-called grass. So it really took a lot of patience, because she did this up to the day she actually passed on. She was able to go out and do her gardening, and then the caregiver had to replant it wasn't actually grass as such. You know, these flowers which have long, thin leaves. That's what they put in the small garden. So she would easily uproot it, but feel very, very contented that I've done the digging. So the exercises and what goes with it can be very, very challenging to the caregivers, but it only needs a bit of patience and consideration, understanding, then both of you will be happy. Dr. Makanga, you had another question, which was to do with food.
Oh, with the foods, yes. What are the, I think, yes, sorry, I missed that one. The foods that one can eat to lower blood pressure. Yes, over the years, there are some foods that have been discovered that have beneficial effects in lowering blood pressure, and there are some societies that draft guidelines in managing high blood pressure recommend initially what we call the non-drug treatment modalities. And some of these non-drug treatment modality is where we also borrow or consult our colleagues like Professor Nakasujja, especially in things like managing the stress and depression and anxiety related issues, because those are also directly related to hypertension. And then when it comes to the foods, there is what they call the dietary approach to stop high blood pressure, which is abbreviated as DASH, and it's in many of the guidelines, including the World Health Organization high blood pressure guidelines. And what does this involve? This involves encouraging eating lots of foods that are rich in vegetables and fruits. And the reason for this is that these leafy green vegetables, especially, and the fruits, have got lots of compounds that help in lowering blood pressure. They also have lots of fiber in them, which kind of lowers the absorption of sugar. So you're less likely going to add on extra kilos when eating these foods. And then there are particular foods like that have actually been directly related to lowering blood pressure on their own. And I think the ladies on this forum who are always in the kitchen might know some of them. I think some of them are things like basil. Some of us men just eat them and don't know what they are called. Basil or parsley, things like garlic, cinnamon, things like broccoli, and many others. And I know there are some doctors. I think I saw someone on the forum, Professor Kasolo Josephine. I think she's doing work in many of these herbal remedies that might be helpful. But some of these foods are actually rich in blood pressure lowering effects. Someone also asked me to make a brief comment about chocolates. I know very many senior citizens love chocolate. And yes, the dark chocolate, the brown one, has also got certain ingredients within it that is known to lower blood pressure, but we do not encourage eating it in surplus, because it also has many other issues ranging from damaging the teeth, and because it has a lot of calories, you're going to put on a lot of weight. So just a little, probably, if you could share it with your grandchildren. So those are some of the foods that we recommend. And then on the other hand, we also want to discourage eating lots of processed foods. Processed foods like the bacons, sausages, basically the baked or tinned foods. And the reason for that is what I discussed in my earlier talk, is that almost all these processed foods have a very high load of salt in them. And salt, like we know, maybe we'll also discuss that later on, is that it's one of the drivers and biggest risk factors of high blood pressure in us Blacks. So we want to encourage a lot more of the fresh foods than the processed foods. I think that's very brief about the foods, if I may. And then, of course, drinking lots of water, which I mentioned earlier.
Thank you so much, Dr. Makanga. Would you just wrap it up with the question, which was to do with herbal medicine? It's really, the question was that, can you comment about herbal remedies if taken without other drugs for hypertension? Just a brief word on that. Okay. I think this is the appropriate time for it.
Okay, thank you. Now, there are quite a number of herbal remedies on the market. There are some that have I'll probably categorize them into two, best for the sake of this discussion. There are those that people are manufacturing in their backyards. They go out in the gardens and get all these roots or leaves or flowers or seeds and make them themselves and then package them themselves. Now, there are lots of challenges with those ones because these are drugs that are based on prior experience from, say, a father or grandfather or something like that. Now, the challenge with such drugs is, as much as they might lower the blood pressure, they are the ones that have a lot of toxic effects to many other organs like the kidney, the liver, the brain, and the gut, because they are not processed. They still have a lot of impurities therein. So many of those, as us Western trained doctors, are not so comfortable with those herbal remedies. Then there are other herbal remedies that have been processed and the impurities removed. Those there and among those, there are very, very, very few that have undergone what we call the extensive clinical trials, where they have subjected them to studies and then put on the market. Those are quite few. So many times we want to advise the patients that please seek advice from your primary doctor before you use many of these herbal remedies, especially if you're going to use them alone or if you're going to use them in combination with your other drugs. I mentioned just one example in my other talk that one of the common herbal remedies that is out there is hibiscus. All of us are very familiar with hibiscus. It has lots and lots of benefits, but we've seen it causing very low blood pressure and very low blood sugar levels in diabetics when combined with diabetic medication or high blood pressure medication. So sometimes we have to know which other drugs the person is taking so that we can advise appropriately, whether to lower the doses of one and also assess their organ function, like the liver, the kidney, the blood levels of sugar, so that we can come to a clear understanding of what works best for the patient. Thank you.
Thank you very much. I think we've understood that very well. For the sake of those who joined us a bit late, this is a session where we are trying to answer concerns, questions from you. And I want to encourage you to put your questions in the chat, your comments in the chat, or to put up your hand if you want to give a direct comment. This is your session, really. Already we've had Dr. Darlene has been challenged to give us a view of what takes place in Australia. I see other people who seem to have some experience outside Uganda. We'll be very happy to share that with you. In the meantime, in the chat room, we have a comment, which is, I think, to do with the Professor Nakasujja. Are there any support community services available in Uganda for both dementia patient and the carers? I think when she answers that, she will also we'll add on what we earlier commented on. Then the other comment is that Mugi used to play football with his paternal grandparents before they exited. They loved it, and you would see it from their smiles. Dr. Nakasujja, how much is this seclusion a manifestation of cognitive impairment or mood disorders? How can, okay, I think at present, Dr. Professor, can you come in and answer those questions?
So the questions I'm answering are one to begin with the seclusion question, which we touched on earlier. And then I also talk about the groups, support groups for the elderly. Do you want me to answer the one on loneliness as well, which is in the chat?
Please do.
Okay, right. So how much is seclusion a feature of cognitive impairment? Like I said, we always have to evaluate. It may be possible that that person is has started to develop challenges in their cognition. And if people keep on pointing them out, because they still can kind of understand what is going on, they may rather keep to themselves and not voice anything in order to avoid, you know, the embarrassment of, say, if someone starts to repeat themselves. We talked a lot about dementia the last time. If someone is so repetitive in their conversation, they keep on saying the same thing, and then people keep on saying, but you already said that. We already talked about that. It gets embarrassing at some point, and sometimes some of them decide to just sit and look. They're still understanding what's going on, but they know that if they open their mouths, they're not sure whether they're going, what they said was already said before, but more so the ridicule or shame, because sometimes they get to realize there's a problem coming on. So like I said, it is important to first do an evaluation for this individual. If you see that they've changed from what they previously were, it is important for you to have them evaluated to understand why they may be secluding themselves. Support groups. Support groups, that's a big challenge. You know, Uganda remained a young country for a long time. It is only now that when I say young, it means that the life expectancy was very low. We are now at about 64, but for the longest time, it used to be in the 30s, then 40s. And it's a wonderful thing that people are now growing older. So those kind of groups are not that present. I can only infer from what happens within communities. So for example, when you go to churches, you find that there is going to be lots of older adults participating in those kind of church activities, volunteering to do this and do that when you go out of Kampala. So a lot of involvement in church activities is a kind of support for people within the communities. I know of a group in Entebbe, I'm forgetting its name right now, but there's a kind of an association that try to get together older adults to keep them active, keep them engaged, continue with skill use, making of maths, you know, whatever it is that they knew how well to do. They would meet once a month, once a week. But that's, you collect people within the communities. I only know that to happen in Entebbe. I don't know anywhere else that it may have continued. We've used that group in one of our researches when we wanted to engage older adults in Busukuma, you know, reviving that which they did. And we had an exhibition and a dress, a fashion show, because they chose dresses they would like to wear made out of backcloth, and these were sewn by a young university girl who was interested in design. We also have the Uganda Alzheimer's Association, for which we are trying to build a community, and the association can have as many different groups. So purposeful aging, I really would encourage that, we put hands together in trying to collect more and more people into this space, because then it becomes easier in planning activities like the ones that Dr. Christina is going to talk about shortly, for support for the caregivers, dealing with challenges, but also creating activities. I've been to places elsewhere where, in trying to engage older adults, for example, they go to the nearest health center within their communities once a week, and they do the things that Dr. Gyaviira has just been talking about, like doing a dance class at the health center. So they engage them in some, activities, and they encourage that when they go home, they continue doing that. Of course, their dances are not as rigorous as might happen in a gym in downtown Kampala, but for those who are still able to, you would be encouraged to do this. A lot of this stuff, as you have realized with this group, is on the initiative of people who love or who would love to contribute to older adults. It's for people who have feelings. So you're going the right way. I can only encourage you and offer support for that. So when it gets to dealing with loneliness for older adults, first of all, if you don't want to be lonely in your older age, if there are people who are still younger than 60 over here, it has to begin while you're young. You have to build social support networks while you're young. You have to engage in activities. Dr. Makanga talked about it. The things we recommend: exercise, walking, actual gym. You have to start them early, because waiting until you're 60 to learn how to do some of these things sometimes may be a bit of a challenge. You have to involve yourself in church activities now. You can't say I'll start when I'm, over 60. Then it becomes easier that after you have retired, you could still engage in any of these other things you have previously talked about. But also, if you haven't, there's still room for you to start at that time. But I think I also want to emphasize that your world shouldn't be only about work, work, work. You have to have other extracurricular, activities that may keep you busy. But in the home, since you have a whole 24 hours and you're at home, invite your neighbor over for a cup of tea. It doesn't have to be anything fancy, in order to keep in touch with people other than just within the home, because when you're within the home, it rather gets very lonely. And many of our older adults now, with our families becoming more and more nuclear, rather than extended as previously used to be, you find them with just the house help in the home, who is usually going to be either much younger, or for whom, the conversations may not be so in sync, as we talked about earlier. So try your best in trying to keep in touch with people. Use a phone, to talk to your loved ones. I know there are older adults now who have iPhones as well, so you can use FaceTime or do a Zoom call with your people, but engage, even if it's a once a week activity. Try to engage in those kind of things. And of course, if there are other activities within the communities that you're staying, engage in those activities. Many times people retire, but when they still have energy, when they have skill, volunteer, to help out wherever it is that you feel you could be made use of. And that will definitely very much help with dealing with the loneliness that comes with retirement. Have a schedule of activities that you have planned out for the week. On Tuesday, we have, I don't know, women's support for, I know of one of my clients who is married, helps out with young marrieds in their church, and they have talks, I think once every 3 weeks, at church. So the time you use for preparation and engaging becomes useful. Take walks, walk around your place, and it should be part of your, scheduled activity. Yeah, you do things like that. If you have money, you can decide to visit places, and yeah, maybe to have a cup of tea, not in the home this time, but maybe once a month you meet with people elsewhere that is outside of your home, where you might have to incur a little something. Thank you.
Thank you so much, Professor. I think you wrapped it up very, very well. Just for the sake of many who have joined a little bit later, I would like to ask Philippa to just briefly talk about that very point of engagement. Dr. Philippa, please.
Yes, thank you very much, moderator, and thank you, Professor, for your invitation to the Alzheimer's Association. As Purposeful Aging, the Purposeful Aging group is actually very interested in partnering with groups like the Alzheimer's Association. And we, like we said earlier, we have a plan in the near future to start a support group for the elders and the carers, because we've got many questions from people who've attended previous sessions, and the carers need support and advice on how to deal with the elderly people that they're dealing with on a day-to-day. And we also wanted to mix that with the elders themselves, because like you rightfully said, the elders have a voice. They have something to say about what we are doing with them or to them. So we want to have that group together and have, we'll start with it on WhatsApp, and we'll definitely engage with you to see what support we can get from you, and we work together to make this a reality. We also want to have physical sessions, because we realize many people do not know where to go, do not have what to engage the older adults with, and we will start small, but we will get there. And so far we have an offer from Tanyuka Square. It's a place in Makerere near Kawanda, where we hope in the near future to start. It could be dance classes, just a music session for elders listening to music from before independence, like they like to call it, and other interactive sessions. And we hope that one day one of these monthly sessions for purposeful aging will be held partly physical and virtual at Tanyuka Square, where we'll have some live feed for other people to engage who will not be able to attend physically. So we are very grateful for that offer to collaborate, and we'll definitely be reaching out. And we also, again, will make that call for people who are interested in joining the WhatsApp group for support of elders and carers. Please put your phone number and name in the chat, or you can send it to our email, purposefulaging@gmail.com. Right, thank you. Back to you, moderator.
Thank you so much, Dr. Philippa. I just want to draw your attention to a comment from Dr. Josephine Kasolo, and please ask Dr. Kasolo to actually just say a few words about it. And my angle is that many of us prepare greens either by putting them on a medic when you are cooking, the steaming matoke, and then you put on enva indira, the vegetables. And I have never imagined what the temperature of that particular method of cooking is. But this is what has been going on in our lives, the whole of our lives. And then if you do not do that, especially for dodo, you tend to fry it. And there you are having the oil and you are having the temperature. Could you kindly just elaborate a bit about the way we cook and what we are losing or what we are gaining? Thank you. Dr. Josephine,
Hello.
welcome. Okay.
Yes, I'm on now. Thank you very much, moderator. What I was trying to say is that when we look at vegetables, all plants are in a whole, you find that the vitamins, of course, those are primary metabolites in the plant. And let's say, like when you look at vitamin C, when you heat it at a higher temperature, you denature it so that you don't still have the vitamin C, which you are supposed to have, and some other water-soluble vitamins. Now, in the same plants, we also have what we call secondary metabolites. Those ones which protect the plant against predators, like humans, like insects, like animals. And then those are the ones which actually we human also use to also protect ourselves. Some of them are antioxidant, some of them are anti-inflammatory, some of them are antibacterial, some of them are anti-cancer, you know, and some of them are even anti-diabetic. So once you also heat it beyond 55 degrees Celsius, you find that they also get denatured. So in order for us to be able to make the best out of the plant materials, we have to cook them at that low temperature. However, most of the time we cook something until it has even become brown instead of remaining green. So I think we have to devise means, like in the villages, what my grandmother used to do, she would not put vegetables on the food, you know, when you have put banana leaves. So she waits when we are almost about to eat, then she would put them on. And we never liked it because it was hard and whatever, but maybe she knew, I don't know, that maybe that would be the best to get the best out of the plants. That's what I've been saying. So the caretakers and even ourselves, we should try, because like when you fry it, you find that actually you heat the oil at a very high temperature, and even you get hydrocarbons, which are formed from this oil which we are heating. In fact, the best way to cook the vegetables, if you wanted to add oil in it, is actually like you put in the onions, you put in the tomatoes, and then you pour in the oil. So that now this oil can be used, you know, to help in the fat, which actually the body needs. I submit.
Thank you so much, Dr. Kasolo. I hope the caregivers or those who prepare the food are okay with that explanation. And want to encourage more questions to be put in the chat room. In the meantime, can I call upon Dr. Darling to give us a comment on the seniors in Australia? Eva's hand is up.
Moderator, it was my hand, but I can make my comment after Dr. Darling.
No, please go ahead, Dr. Makanga. I think I've been given a very broad question. I don't know how best to, and it would be best to get a question. Maybe I would then be more direct.
Okay, mine was a very brief. I wanted to first of all thank Professor Josephine Kasolo for the comments she's made, but it's just to re-emphasize one or 2 points that she's made that is slightly into my area when we are discussing with many of our elderly patients who have kidney disease. She did mention something about heating food, and for example, at high temperatures, especially when frying and the food gets brown. And for many of us, when we see a browning of the food, like say omelette or meat, that brown layer that forms, people get so excited that now it's ready and good to eat for all of us. On the other hand, on the health part of it, that browning effect, in the medical terms, is what they call, you've actually formed what they call edges. I will not go so much into detail about them, but these substances eventually go and are the ones that are deposited into the lining of our blood vessels and damage them, and then cause disease. Basically, eventually start causing what Professor Kasolo was talking about, the inflammation, and then the vessels become very sticky, and then cholesterol sticks to them, and then they get blocked. The other was about the oils. When you heat oil at very high temperatures and for a very long time, and many times this is the frying that she talked about, that prolonged frying using oils causes very, very, very toxic substances. And those toxic substances actually directly damage blood vessels, especially the tiny ones in the heart, in the brain, in the kidneys, and many other body tissues. And some have unfortunately been linked to the cancers that we are seeing. And so it goes back to what she was emphasizing, that steaming of foods is the safest and best method for preparing foods, especially for the elderly citizens, but also for the rest of us who have not yet hit that age group. Thank you. That's what I wanted to supplement.
Thank you so much, Dr. Makanga. I just wanted you to help us understand this better. I have walked out of my home. I've gone to eat out, a takeaway, and I believe this is the oil which has been, like if you got 3 o'clock, this proprietor of the takeaway has been using this oil from morning, hitting the chips in that oil the whole day. Am I in danger or what? What can we do? Because we want to get this thing as practical and real as possible. Do you want to encourage, to discourage us from eating out, and what do we do? We are stuck.
Well, thank you for that question. It's a bit of a tough one. I don't want to discourage or scare people, but I just want to put a few facts. Probably, if I'm to approach it from a historical perspective, about maybe 30 years back, we did not have that many takeaways around, at least here in Kampala. And I think as the population grew, people became busier. Usually food restaurants and food service providers have responded by also preparing foods in a very fast way. Now, it is not always true, but it is assumed that the faster a food is prepared, the more salt it has and the more chemicals it has. I'm not saying it's always true, but it's a very big assumption, and in many times it might be true. So the faster the food is prepared, the more salt, which we've already alluded to, that a lot of salt causes high blood pressure and many other problems. Again, the faster it is, especially in these food restaurants where they're using a lot of oils, the ideal many times would be to use that one round of cooking oil and then pour it off, and then use a fresh round of oil, which is very costly for those restaurants, such that they don't expose, for example, the new fries or chips with the previous oil. But that's not what happens. So I think the advice here is going to be to minimize eating those chips in the outside restaurants if possible, or better still, there are people who have actually decided to prepare the chips at their own homes. Because I know for many people, you will actually use one round of oil and then discard the oil. But again, we don't want this to be very regular. We don't want to say do not eat the fries or chips, but it shouldn't be an everyday thing like we've seen, especially people who live alone, the young population many times, who feed on the famous Rolex. I mean, that's their meal every single day. That's not a very good healthy meal at all. So once in a while, they need to actually eat the vegetables or the fresh foods, so to say. So I think there is not a clear answer, but it's at least people to be aware that these are not healthy foods for us to eat in the long run and for a very long time. They are quite dangerous for any one of us, but more so for the elderly citizen. Thank you.
Thank you so much, Dr. Makanga. I think there is also emergence of a dry heat roasting or baking. It might be one way we will avoid the oils. We have a question in the chat from Angela, and I think it really wraps both Professor and Dr. Makanga, and I think we have covered a lot of it, but for the sake of Angela, we can once again go through it, and also encourage others to, put up a comment or a question, because we do have a lot of questions, but we'd rather have you engage with us right away, live. The question, I think, is I had it as if I had I had it was, as we get older, we need to be more active than ever. From experience, I live with my grandma and she's having high blood pressure. But when I try to tell her about exercise, she really doesn't want to understand. And is there any advice or technique I can use to engage her in physical activity? And B, she moved from her village to town to be taken care of. Maybe doesn't this contribute to her resistance to physical activity? Any advice, please help. Yes, I think this can be thrown to everybody on board. Anyone with similar experience can let us know how they overcome it. Please.
I'll go first. I'll go first. So the one rule when it gets to management of older adults, and the one thing that affects them so much as regards their mental health, is for them to be transported or transplanted from their homes into a new home. When we grow older, it's a little more challenging for us to learn new things. And many older adults find that as a big difficulty when you try to move them from their homes and trying to manage them. Now, in Kampala, we have that tendency a little too much, that when grandma falls ill, then people put her on the bus or they go pick her up and they bring her to Kampala. Of course, I guess there are things like costs and stuff like that that may lead to such an arrangement. But the fact is, it will not take away the fact that this older person is going to be very unhappy in your home. They are happier in their familiar surroundings that they've always been with. If at all anyone had means, the best way to help them is for you to come treat them, then let them go back to their homes. I can't just express how often they tell me that I want to go back home, I want to go back home, and they do not understand why they're being made to stay within the city. Of course, we bring them to the city thinking that we are providing better for them, but for them, they're happy within their homes. So yes, this older lady may be unhappy with you, and the resistance that they sometimes have, maybe come from because they're unhappy with the living situation. But also, if you want to encourage someone to do something, it's the same thing like when we have children. If you want a child to learn how to mop, you also get a mop and you say, let's clean the house, then they'll learn how you're doing this. So if you want them to do exercise, get them and say, Jaja, let's, take a walk around. Let's just walk around the house for starters. Let's go and look at the flowers, somewhere or something like that. Rather than if you ask them that, you can go out and take a walk, or you leave instructions, Jaja should go out and walk. They'll not do it if there's no one else who is doing it with them, especially if it's an activity they've never engaged in previously. It becomes difficult for them to learn how to do this stuff, and they don't even appreciate why you're insisting that they should walk in the first place. That's my contribution. Over.
Thank you so much, Professor. Do we have any other comment?
Yeah, I just
Mr.
wanted to add to
Secretary?
that. Oops, sorry.
Mr. Sengendo, would you like to contribute? Hello.
Hello. The volume is still low. Our volume is still low.
Probably switch off your video, and if you want to contribute. Okay. I think it's not ready to contribute. Dr. Dallin, would you like to contribute on this?
I think I just have the same comment really entirely as Professor has said. I think I just can't say it any better. I think she's entirely said what my thoughts were. And passive exercise really, in addition to what she has said, and that as she said, get involved with them. Nature activities would be very interesting, or especially engaging them with other people or their peers, because sometimes, as I said, they might have that age mismatch. And if you have some other seniors they can get involved with passively, passive activities they enjoy, they just might get a little bit active, you know. And then again, also to go back onto the question of exercise, I think get moving, however much you're moving, how you're moving, just get moving and gradually increase that activity. Do not leave out strength building exercise. I know for many of us, we equate it with going to the gym, but as we get older, we all lose our muscle mass, and the only way we can keep it on is by trying to do some activities that will help us retain the muscle. You don't have to go to the gym to do this. You can do it with exercises or body exercises. That's a different session altogether, but I think just getting in activities that will engage different parts of the muscles so that you keep your muscle bulk, in addition to aerobic activity, which will be foreign to many people, but I think starting with the day-to-day activities, as we mentioned, would be a great start, and then we can gradually work up these programs to increase our activities and ability to cope with the different needs that arise, you know, with the exercise loads. In terms of the seclusion, I think Professor Nakasujja mentioned that. I find that many of us, in my setting, I would find that many people who do have the seclusion, it is a big pointer to changes in their cognition, and therefore it's very important to make sure that loneliness is not a part that is contributing to that, and trying to engage them will be very helpful, and excluding those other conditions which we mentioned. But other than that, I don't have much more. I think that's just generally a small snip of what I have, considering what we've been talking about.
Would you like to say something about support groups within the communities and how those may be arranged over your side?
I think support groups are very, very helpful. I think I can't, it's very important. I think they do help a lot, because one of the biggest problems, as you said, is just these people do not have their peers. Some of them have lost their peers, or you find that there's that dissociation between the age groups. But having those, what we tend to do here is many of those, especially those who are in group homes, there's activities. People go out for tea on Monday, then Tuesday you go to a men's shed. On maybe Thursday you go out and meet with a singing group. So somehow somebody is engaged, you know, in several days of the week, and that way, you know, you keep people active. They get out of this, because of the one of the biggest problems is the limitation in mobility. But if they can get out of their environment and go out, it lifts them up. They meet other people they can engage with. It does play a very big part in both mood, cognition, and also it gives the caregivers some kind of relief, if I may say, because then these people they have some time to themselves, the caregivers. So it works. It's a two-pronged approach. I think it helps both the caregiver and the elder person in activity. But I find that these have to be organized on, you know, fortunately, we tend to have communal ones here, and in a way, it is also government supported or local community supported. So it's much easier. But I think the frequency does matter a great deal. I think on a weekly basis makes a big difference. Once a month is not bad, but I think making it more often. I know I have so many patients I see people I look after, and the one thing they look after, they would tell you on Thursday, this is what is happening. I can't attend this, I can't attend this. And they always look forward to these activities, and they are always more, when you see them after they've been for these activities or when they're going to them, they are a different person compared to when you've seen them, so, well away from those activities. It just peps them up in a way that keeps them going. And then carer stress, is what I was saying, I find, for example, more recently, I have a gentleman who has been looking after his wife who has been seriously affected by Parkinson's disease, and she can't really, he's been at it all the time. And the time that she's been in hospital with us, he's kind of now let loose. So if I may say, he's got time to himself and he's a different person, So it works both ways, as just to illustrate. So the time would help a lot.
Thank you so much for giving us that version of Australia. We can appreciate the lack of some of these services here, but that will not stop us. We are purposefully aging and very determined. I've seen Dr. Kasolo's hand up, but now it has disappeared. Doctor.
Yes, I had got disconnected, but now I'm back. In fact, what I wanted to say is that even the old people, that's where we're all going, they also have the urge to move. This is a physiological urge. If they don't move or do exercise, most of the time they may be feeling pain somewhere. So we have to look out for if there is any pain. And then secondly, we can help them by doing massage. Massage, I'm not looking at enthusing the skin and whatever, but whereby we have got passive contraction and relaxation of the muscles. And then we can put some pressure on the muscles, they will contract and relax. And then as they gain muscle strength, they themselves will be willing actually to move out. If that urge is already there for motion, for mobility. So we cannot ignore that. So we have to look to educate the caretakers to be able to do massage. And then after that, these people will continue, and then they will continue willing to move and move. And if they're not willing to move, there must be something which is actually causing it, and which we have also maybe ask the doctors to look at it and see, are they depressed? Are they not willing to talk to anybody or whatever? So we have to look at that massage carefully as we manage the people in old age, or in that age bracket.
Wow, thank you so much for that tip. I think Dr. Philippa, that has gone down very well on your side. Most of the preparations we've had so far, the sessions have been online, but that is a very, very big area we have to look at. And there is a question actually in the chat present, that can we share some places where we can take elderly for these activities, say in Kampala, Jinja, Mukono. As an immediate answer, we had asked everybody on board today that if you are interested in forming group, we intend to form a WhatsApp group where we shall give advice, where we shall share, and where we shall plan what we really need for the seniors and everybody else who is on the way to seniorship. So please put your comment, put your contact in case you want to join this group, or you even just want to give advice to the group. You can communicate on email, which is going to be put in the chat chat again. And we keep sharing. I think this is all about sharing. Dr. Gyaviira's hand is up. Please come on, unmute and communicate.
Yeah, it's just another addition to what Professor and Darlene and Professor Kasolo have said about the inactivity that they've emphasized and re-emphasized. One of the things that I don't want to forget that we need to encourage the senior citizen to do is to always or try to go out in the sun. This is very important for all of us, but much more important for the elderly citizens. I think even Angela, who says, I think the mother is probably, I'm assuming the mother is always indoors, and that doesn't help at all for many reasons. The sun is very beneficial for both mental health and physical health. Mental health in that there's a way it boosts the mood, it keeps you happy. It produces those happy hormones to probably help you going. It has also been associated with minimizing depression. We know for those countries, some of you have visited them, where they have very short days and very long nights. The depression rates are much higher. The suicidal rates are much higher. And many times when the sun is out, they all run out because they know. So for us here in Uganda, for example, who are blessed with sun for more than 8 hours, it's always good to encourage the elderly who are many times indoors to actually go out. And the best time is the best time for that exposure that will give you additional benefits is like now, probably between 10 and 4 p.m. That's the best time. And usually it's not for long. Usually the recombination will be maybe about 15 to 30 minutes, but it varies because there are many other aspects we put into consideration. Naturally, the darker we are, the more sun exposure we need because our dark skin kind of resists penetration of the sun rays that are going to benefit us to get that nutrient that we need, the vitamin D. And that vitamin D in addition helps to strengthen the muscles and bones that Professor Kasolo is talking about. So you might be indoors and you're doing the massages and the exercises, but your bones are weak. Among many causes is actually that vitamin D deficiency or loss. So please encourage the senior citizens to always go out into the sun. Thank you.
Thank you, Dr. Makanga. And before you really go off, there's a question which has come in from Gideon. Is there a way to lower diastolic blood pressure? And how best can one manage situations that frighten them and cause blood pressure to rise? Please just clear that one in a second.
Okay, maybe I'll clear it in a minute. For those who may not know what diastolic blood pressure is that lower reading of the pressures that they take. There's always an upper reading and a lower reading. The lower reading is the diastolic, when the heart is resting. That's what we call the diastolic blood pressure. Now, the most of the measures that lower blood pressure that we've talked about, good diet, physical activity, low salt, managing stress that Professor Nakasujja has highlighted, will also help lower that diastolic blood pressure. There are a few particular conditions, medical conditions that we have to investigate that might increase that diastolic blood pressure, especially in the young population that we need to address, and those might need particular drugs after a series of investigations. But by and large, these other general measures that we've talked about, low salt, good diet, physical activity, stop smoking, no alcohol, and then
Okay, one or two words. Getting older puts you at risk of developing things like anxiety if you didn't already have them as a younger person. Because of the points I pointed out earlier, the change of roles, the losses that you're experiencing, the illnesses that you're getting. So it's a big issue that would need to be evaluated, and for one to then be helped as per the specific issue that is getting them to be fearful. So oftentimes we have a range of psychotherapies that can be engaged in helping these people to cope better and learn how to deal away with the anxiety. But if very severe, in some cases, we may even have to use medications to help to control them. That's in a brief.
Thank you so much, Professor. I see we are nearing midday and we still have a few questions and comments in the chat. I want to thank you so much for having actively engaged in this last 2 hours. It's very encouraging. I'll read a few of these chat messages and ask Dr. Philippa to once again give us answers to some of these questions I'm going to read and also close the session. One of them was a comment from Shiba, not Shiba, no, from someone from Rwanda. Let me just see. Oh, God. Yeah, from Eva. She says that we recently formed a grandma's club that is age 58 to 85 years old. And some of the activities we do is going to the gym. We have coaches who first check our blood pressure, etc. before we start. It's become so much fun. And she's just sharing from Kigali. I think this has wrapped the age group, which is the worry of someone from Mugi who was suggesting that, like in purposeful living, I think even middle-aged group should get such purposeful aging sessions to guide them as they grow older. And Philip Sechimpi, on behalf of Dan Sengendo, is saying, is there any arrangement as elders to meet and testify the challenges we went through, even those who have been practicing, and their health status from Dan Sengendo? Dr. Makanga, I think these questions are interrelated. Please answer them up once again and close up the meeting.
Thank you very much once again for moderating the session. I'll comment about the meeting and the groups. And I think there was also a comment from Irene about places to go to. So like we mentioned at the start, we are in process of forming a support group for carers and elders. And we'll start with the WhatsApp group, but we also intend to have this happening physically. So if you would like to be part of this group, please send us your phone number and name, and we can add you to the group. And we can also let you know when we are going to start having physical sessions. We will also be working together with the Uganda Alzheimer's Association, courtesy of an invite from Professor Nakasujja this morning. So just let us know via email, or you can send a WhatsApp or text, whichever way you prefer, or you can put it in the chat just now, and we will be able to include you once those become available. Professor Nakasujja also told us about a group in Entebbe where elders are meet once a month. They might not be doing so now, but yes, there's something in Entebbe already. And we also intend to do something at Sanyuka Square, somewhere in Kawanda near Namalele. It's very accessible and there's space for people to walk, dance, meet every so often. And once that is up and running, we will also let you know once you leave us with your contact. Yes, I think that summarizes the issue of meeting, places to meet. And Dan Sengendo will also get in touch with you once this group is up and running. So, okay, I see Florence has posted her contact. Thank you, Florence. To close the session, I'd like to thank very much Professor Nakasujja and Dr. Makanga for giving us their time and answering our questions, sharing a wealth of knowledge with us. It's very interesting how I thought this would last an hour, but it's gone 2 hours and I was not bored for a minute. We are very grateful for the time and the information you have shared with us. We are very grateful also for the people who have been with us during this session, our audience. We've had over 40 people for the actually, I think the whole session. We've had over 40 participants with us. We don't take it for granted that you took out your time on a Saturday to come and join us. We are very grateful for that, and we are encouraged. I've got so many comments on WhatsApp on the side, people who have been going through so many things and have benefited from the information that you have shared with us today. We also had very good input from some of our guests, Darlene from Australia, we had Eva from Kigali, we had Professor Kasolo from Uganda. It's very encouraging to see that there's a group of people who are interested in living purposefully and making it better for those who don't know what to do and how to get it done. So thank you very much, our moderator. I have no words for you, but thank you very much for making it an engaging session and keeping us alive all through the session. Thank you, and we will have our next session at the end of August. We will again communicate through our usual channels to let you know of the date and the topic. Thank you. Back to you, moderator.
Yeah, thank you so much, Dr. Philippa, for the wrap-up. Once again, we shall meet again on the last Saturday of August at 10 a.m. Thank you so much for keeping time and staying with us and challenging us. We shall live purposely. We shall age purposefully together. Thank you so much, and bye-bye.